What if you've already had COVID-19 or you think you might have? Should you still get the vaccine? Hi, and welcome to Friendly Pharmacy 5. My name is Lindsay Dixon, and I'm a pharmacist here from British Columbia, Canada. So if you think that you have had COVID-19, even if you have had a positive PCR test that confirmed a COVID-19 infection, it is still recommended that you get the vaccine. Vaccination of people who have been positive for COVID-19 may be somewhat delayed, and these people may not be prioritized as quickly, as we do know that there is somewhat of an immune response that does last for a few weeks to a few months. We do know that reinfection with the SARS-CoV-2 virus is extremely rare, especially in the first 3 months. Now, if you think you've had COVID-19 but you did not get a test, it is not necessary for you to be tested in order to receive the vaccine. There is no concern that someone who has had COVID-19 would respond in any negative way to the vaccine. Much to the contrary, it would probably just reinforce the immunity that they already have. What is important is that the individual waits until their period of illness and all of their symptoms have completely resolved. For example, the flu vaccine. It happens very often that someone will be booked for a flu vaccine. They will come in and they will say, listen, I just had a cold. I'm really not feeling that well. In this case, it's probably best for the person to wait until they are feeling better. And so it is important that you wait until all of your symptoms have resolved, and maybe even give yourself weeks to months, depending on when you're eligible for the vaccine, for you to actually go and get the vaccine. So if you're pregnant or breastfeeding, should you be getting the COVID-19 vaccine? So because the clinical trials did not have patients who were pregnant or breastfeeding, we actually do not have data in these populations to support recommending the vaccines at this point. We will have more data over time. At this point, it is recommended that those who are pregnant or breastfeeding discuss the risks versus benefits with their healthcare providers. If someone is pregnant or breastfeeding and they are deemed high risk, it may be decided that it is more beneficial to have the protection of the vaccine itself rather than wait. This will be determined on a case-by-case basis with your healthcare provider. There are some pregnant women who are also medical professionals that have been getting the vaccine because they are high risk. And as this happens more and more, we will have more data as to the safety and efficacy of these vaccines in pregnant and breastfeeding women. So we do not have clinical trial data concerning these vaccines and their efficacy in children yet. We cannot test vaccines in children until they are deemed safe and effective in adults. And so now that we have the approval in adults for some of these vaccines, these laboratories will now be testing in children. And NACI is making a recommendation that children who are ages 12 to 15 may be considered for vaccination depending on a risk versus benefit analysis and that can be determined by your healthcare provider. There will be more information about these vaccines and their use in children as time goes on.